Good morning, and thank you for joining us again. I'm Lori Cranford, and this morning I'm talking with Dr. Jonathan Chae. Dr. Chae is a board-certified orthopedic surgeon and a fellowship-trained sports medicine physician. He joined Central Indiana Orthopedics earlier this year and practices in the Marion and Muncie offices. Dr. Chae, thanks for coming in this morning.
Thanks for having me.
Yeah, we both slid in this morning, right?
Yeah, the roads were pretty bad today.
Yeah, so if you're watching from somewhere where it's not slick, good for you. Be careful out there. So before we dive into your work, tell me a little bit about yourself outside of CIO, your family, what you like to do.
Sure. Well, I'm married. My wife, Brianna, and I live here in town in Muncie. We have a 2-year-old son named Landon.
That's fun.
She's from the area, so we're thrilled to be here. And you know, things outside the office. I enjoy playing golf. I like traveling with my family. You know, sometimes we try to cook healthy meals and try to exercise, and then we go on these binges. But I think, like most families, that's kind of an on and off cycle. So.
Yeah. Well, that helps your patients relate to you because you're just like them,
Exactly.
just like the rest of us.
Exactly.
Trying to do the right thing, and not always.
Mm-hmm.
So you earned your bachelor's degree from Emory University, Atlanta, your medical degree at Wright State University in Beaver Creek, Ohio, went on to do your orthopedic surgery residence at the University of Kentucky in Lexington, and did a sports medicine fellowship at William Beaumont Hospital in Royal Oak, Michigan. In other words, you get around.
Yeah.
You've been a busy guy. Where were you coming to prior to coming here?
Orthopedics there. We decided to move here though for several reasons. One, I just fell in love with the mission statement of this group, being in a large multi-specialty practice. Really. For my wife, she's from the area, and she loved the idea.
When did you know that you wanted to be a doctor? And
My grandfather, you may not know this, he was a general surgeon actually, and he practiced in Korea and in Africa and
Wow.
here in the States as well. So talking to him, I got the idea in my head at a young age that, I think being a doctor would be a great profession. As far as orthopedics goes, probably like most orthopedic doctors, I had an orthopedic injury. I tore my ACL at 19, and through the surgery and the rehab process, I just kind of fell in love with the specialty, and that's where I'm here today.
wow. So you decided to specialize in arthroscopy and shoulder replacements. What kind of issues would a patient have that would require your kind of care?
Any patient that has general pain or stiffness in their shoulder or their knee, and I don't think it's a bad idea to always get it checked out by either your primary care doctor or someone like myself who specializes in that area, just to make sure that it's not anything that is, requires anything.
Drew you to that type of practice as well?
Well, sports has been a big part of my life at a young age, and as I try to figure out exactly what field I wanted to practice in, I really fell in love with that sports medicine patient population. I love working with athletes, and I define that very loosely. You don't have to be considered an athlete if you're not a college or a professional, player. I think athletes are defined by being, a dad who wants to play basketball with their kids. If you enjoy playing a round of golf, or if you enjoy playing a round of tennis on the weekends, I'd be happy to see you. The reason is, these patients, they're highly motivated to get better, and I really enjoy being a part of their care and seeing them get better.
Yeah. We talked earlier as a marathon runner back in the day. It was really important to me when I got injured, when I had a lower back injury and went to see a doctor, and I said, I have this goal of running the Chicago Marathon on my 50th birthday, and you're going to help me get there. And he looked at me, he's like, well, you got some stuff going on here, but okay. So from that perspective, we do really appreciate when you invest in us and say, we want you to be able to achieve your goals. So appreciate that kind of care. So speaking of sports, fun fact, you worked with an NFL team. What was that like?
Yeah, so I spent 1 year doing a fellowship in sports medicine up in Detroit, getting subspecialty training. And I was lucky because my mentor there was also one of the team physicians for the Detroit Lions.
Wow.
Fantastic experience. So for 1 whole year, I got to see what he did and did what he did, you know, in the locker room and in the training room and on the field. And I think it was a great time. It was fun, and I learned a lot in that 1 year.
Yeah.
So,
is there a way that those kinds of high-level athletes need a different kind of treatment that you gain a different kind of perspective on?
good question. While there's while no one questions that, you know, high-level athletes such as, you know, NFL players get immediate and quality care, I really try to take what I've learned from that environment and bring it to my patients here in Muncie. So, you know, so overall, I would say that the care in terms of the non-operative treatments, the surgical techniques, it's the same level of care that any NFL player would get.
Okay. So, non-medical question: did you get to hang on the sidelines at the games?
Yeah, yes, I did, and it was a great experience,
Did you
especially
run
from a
in
fan perspective.
from the tunnel with the team? Or?
No. You know, the
Yeah,
fans.
shoot, man.
You know, fans they're there to see the players and the coaches, and you know, being on the medical team, we're just more in the background. But you know, for me and being a fan, that's good enough.
Yeah, that would be fun. So, what type of patients do you typically see, and how do you determine if they need surgery or if they don't?
Great question, and kind of a hard one to answer. So the types of patients I see are shoulder and knee pain patients primarily. Hard to determine that, just, you know, unless you actually meet the patients, you talk to the patients, you know, what the problem is, what are their goals. You have to examine them, get some sort of advanced imaging like an X-ray or an MRI, and you kind of combined all that data, and you know, it's a team effort between the patient and myself. We come up with an individualized treatment plan. Sometimes that requires surgery, but more often than not, it's usually a trial of some other non-operative treatment, and you know, that's very tailored towards that specific person.
Okay. So, how does a person know when what they have requires the care of a specialist versus a general practitioner or you know, a local medical center?
Yeah, you know, unless you have a medical background, I think that's a hard thing for any one patient to really figure out. You know, my give it sufficient rest, and it really hasn't gotten any better. From a specialist perspective, you know, I don't mind seeing those patients, you know, just to get it checked out, you know, and it may not need surgery, and that's okay, you know. And I think the important thing is knowing if the problem is serious enough to warrant a procedure, or if it's just something that will get better with time.
Okay. So, since you haven't been at Central Indiana Orthopedics very long, you've got a fresh perspective on this practice.
Mm-hmm.
Tell us what your experience has been so far.
You know, being at CIO here, I'm just so impressed with the staff and the other physicians here. Just being in a practice that is, you know, where everyone can just kind of really focus and hone in on what they love doing, and you know, treating patients in a really specialized way and giving them individualized care. For myself, is really refreshing, and I've really enjoyed being here, and it's been a great transition.
That's great. Well, welcome to CIO. We're glad to have you here. We appreciate your time and your expertise and your insight today, and the personalized care that you provide to your patients. So thanks to our audience also for listening in.
Well, thank you.
We're glad we were here. We were here. Glad you were here. Glad we all made it here safely is what I'm trying to say. If you want to learn more about Dr. Chae's work and the other amazing physicians and providers at Central Indiana Orthopedics, just visit ciocenter.com. Thanks again for listening in, and happy holidays, everybody.